Hi, I'm Dr. Jerome Blackman, and I hope that you can join us starting on October 10th for a series of 10 lectures regarding dynamic therapy technique. Um, I think this series will be unusual in that I will try to refrain from just discussing platitudes about empathy and understanding and gathering information and so on. Instead, I want to focus on specific technical problems that include a little bit about evaluation and quite a bit about the treatment process. Some of these ideas apply to psychoanalysis as well as a treatment, but you'll see that the thrust of the discussion will be about modern psychoanalytic ideas as they apply to dynamic psychotherapy. We'll cover such topics as how do you find an unconscious defense mechanism? That's a good trick. We all know that defensive operations are unconscious most of the time. Well, they're not all the time. Sometimes they're conscious, such as saying to yourself, I'm not going to think about that. But most of the time, when we see pathology, we'll see defenses like repression, isolation of affect, sometimes displacement and identifications. How do we identify uh, the multiple defenses that people are using without knowing it? I discussed this a little bit in my first book that's called 101 Defenses. But here, I'm not just going to lecture, we'll take some of your case material and discuss that too. Uh, Another topic we'll tackle is empathy. Well, we all assume we have some empathy for our patients, but is that ever a problem? Does it get in the way? And when should we reveal to our patients that we have some reaction that's empathic? Sometimes it's a good idea, sometimes not such a good idea. And I'll discuss some of that with you too. Um, how and when do we try to interpret anything about transference, right? And patients' thoughts and feelings about us. How do we handle that? Are they simple defenses like externalization of the superego or projection? Or is it a whole transference from 5 years ago, 10 years ago, 30 years ago, 50 years ago? Right? And how do we go about doing that? What's the timing of looking at transference? That's a tricky business. We'll look at some modern techniques regarding how to confront pathological character traits. For example, laziness, obnoxiousness, shyness. I just wrote a chapter about shyness for Salman Akhtar's new book called Unlit Corners, which of course I can recommend to all of you. Um, Other character traits we may see that are problematic. And what do we do with them? How do we confront them? Do we do it aggressively, kindly, gently, not so gently? What kinds of factors do we have to consider? What about patients who are severely inhibited? They don't talk to us too much. How do we handle that? On the other hand, what do we do with patients who are impulsive and maybe excessively loquacious? Huh? Now, theoretically, I want to tackle with all of you the idea of compromise formation as modified from Freud's early 1926 formulation through Brenner's 2006 book called Psychoanalysis, Mind and Meaning. Does the idea of compromise formation, which involves wish, reality, superego factors, affect, and defense, do all those factors always apply when we see psychopathology or any other type of thing that comes up in treatment? Of course, Brenner thought everything was a compromise formation. Other people don't, including Hartman. And I have sort of a balanced view of that, which I'll be glad to discuss with you. Um, who needs corrective object relations technique? And when should we not use it? Sometimes this is called relational psychoanalytic technique. When we introduce certain elements of our own personalities or opinions into the treatment. And when should we do that? How much should we do it? how much self disclosure is dangerous. And we'll have some discussion about that, particularly with borderline patients, where most people think some object related interaction with the therapist is requisite. What do you do with it after you make those types of interventions, though? And the patient has reactions to it. Uh, how do we determine if an intervention like clarification of defense or showing parts of a conflict is successful? I mean, psychotherapy is supposed to change things, right? So if we are able to interpret something to somebody, we hope that they think about it and maybe make some changes in the way they think. How can we tell if we've been able to do that? Hmm? Well, Robert Welder wrote about this in the 1960s and 70s, and I've added to it. So I hope to give you about 8 or 10 different ways that you can judge whether your intervention has been successful, unsuccessful, or perhaps damaging to the treatment relationship. And basically, it's looking at how the patient responds. Many different factors there. Um, and then let's see. Finally, we'll deal some with countertransference. Very popular topic today, right? What's the difference between countertransference and the real relationship that was discussed by Anna Freud and others since then, Mitchell, Stephen Mitchell, and that group of analysts. And then do we contrast that with the work of Erwin Marcus and others? So and my own studies of that. So I think it'd be a very robust, interesting seminar, and I hope you can join us. For a little bit of flavor, if any of you would like to engage in some role play with me where you actually speak as though you're the patient, then I'll try to treat you. We may do some of that. We may do the reverse, where I present material disguised as though I'm the patient, and I'll see if you can use some technique to treat me, and I'll tell you whether you're doing it correctly or not. So we can have some fun with that. And I hope that it should be a very informative and interesting series for you. So I look forward to seeing you then. And I thank Dr. Rosensfit for inviting me back to do some teaching with you. I look forward to it.